Hello, everybody, and I am so happy and excited that finally I have this video about complications of dermal fillers, and that is the first question I get when I have my patients on the first visit trying to get lip filler, nasolabial, or any facial rejuvenation based on hyaluronic acid injections. So let's just start with this. And the truth behind VO after fillers. So first, VO is no more than vaso-occlusion. That's why we call it VO. And I have a question for you. Have you stopped or canceled filler treatments because you feel scared about having a complication that can give you health problems? I don't know, maybe. So here, it is this article from 2022 by Dr. Danny J. He's an MD. And I love this one because he is talking about the pathophysiology and molecular mechanisms of the hyaluronic acid fillers that can induce vascular occlusion. And he is very in detail with this about how this happened, but also he's giving us practitioners how to avoid them and what to do if unfortunately we have to deal with this complications. So the popularity of these injectables have risen in the US, like you have no clue, like you cannot imagine, like it's like billions of dollars. And because the treatments has increased, of course, complication has increased. That does not mean that we are doing the job bad or fillers produce complication that can end in necrosis. No, that's not what I'm trying to say. What I'm trying to say is that the more treatments we have, the more complications we can have. And that is like common. So because of that, they started to request all practitioners in the United States that whenever they had a VO, a vaso-occlusion, they should report it so they could know what to do and design a protocol of what other therapeutics treatments can be done in order to not to finish in a necrosis. So this is what I love this article. And then if we go here, it says that vascular complications in the USA since 2015 to 22. I'm not talking about before that, because even though that these fillers have been out in the market for more than 20 years, only from 2015 to 22 is when practitioners started to report these complications. And I guess it's because they were scared about them, losing their license or being in trouble, which is not the case. Anybody can commit a mistake and we are humans. But since they started FDA 2021, they show that in 7 years, more likely, they have only 470 vascular events reported. I'm not saying we didn't have more or less. I'm just saying the ones that were reported. So I'm very happy these doctors or practitioners or nurses were able to report this. So this doctor and FDA could make a protocol for us to do something when we are facing this unfortunate situation. So the majority, if you see this pie chart here, the majority of them, 68% of them, were like nasolabial sites. And as you know, nasolabial sites is this. And I must say that in my practice, it's not the top one, but in middle-aged women and maybe 20 late women, they ask a lot for nasolabial. Now, why anatomically is nasolabial giving us more problems with VO? Because of the angular artery. And anybody who's doing this as a job knows that this area is the area where we can have a occlusion of the vessels. So it's not because the clients or patients are asking more that area, or because it is practitioners doing it wrong. It is because the anatomy in the face, we have more vascularization in that area, which of course we can have a vaso-occlusion or a vascular complication. It's not more than that. Now, I want to go into the most important part, which is how this happened. And girls, this is for you, and this is for any practitioner who is doing this job. As you can see here, we have first vasocannulation, okay? Then we have vasoinoculation. Then we have vasodissemination. Then 4 is vaso-occlusion, and 5 ischemic injury, which is what we are all scared of. Even me as a practitioner, I don't want to have to face that. So what is vasocannulation? So vasocannulation, in the first picture, you have letter A, and that is for direct. So it's when, unfortunately, by putting the needle inside the face, we inject the hyaluronic acid not into the intradermal area, but inside the artery. In this case, it's showing an artery. Now, in the picture B, we see an indirect. So it means that we pass through the needle and went too deep and cross. So it is indirect because we are breaking the vessel, and by the spread of the hyaluronic acid, then it can go inside that vessel. So maybe you will not see as a practitioner, or you will not see as a patient during the treatment, but you will feel it later. So that's why this is really important for you to remember. And if we continue, there's a difference between the first 2 steps and finish in the 5th, which is necrosis. Why? Because our body, all our arteries, and they have anastomosis. And anastomosis, it is a definition of how arteries, as a tree, they let's say fusion in order to supply the area with blood no matter what. So if we have, like in the picture A, if we have like a bolus of hyaluronic acid blocking a branch, imagine a tree. You have a tree. So imagine you're blocking the branch. Of course, all the areas after the branch are gonna present ischemic injury. And if you're not blocking the area, or you have anastomosis, which is picture B, the blood supply is gonna be supplied by another branch. So let's say you have the unfortunate situation of hyaluronic acid being injected inside one of your arteries. That doesn't mean you're gonna finish in ischemic injury, because we have other vessels trying to supply that area. So just for you to know, not because we can have a vasoinoculation means that we will end in a ischemic injury. So there you are. Don't be afraid of having fillers. Now, I want to show when we unfortunately put the hyaluronic acid. If we put a big bolus, of course, we're going to create, like picture C, a grade vascular complication, but that is going to depend on the amount, and not only the amount of hyaluronic acid, that depends also on the brand, depends on the molecular structure of that hyaluronic acid. So when you are doing hyaluronic acid in your face, you have to know that there are 2 types of hyaluronic acid. We have biphasic and monophasic. So biphasic are more the ones we use for cheeks and chin, and kind of like change the appearance, projections. That's the one we use in areas that we know there's less vascularization. Now, when we're working in areas that we have a lot of vascularization, we use monophasic hyaluronic acid brands that we know that if they go into the blood supply, if we finish on this, they don't have that structure as strong, and their absorption to water is higher, meaning that they would not produce a block. They might try to spread into the bloodstream, and that's why they're softer. That's why they less in a period of time, just short weeks, because they are designed for this area. So when you're going to get your fillers, ask your practitioner which brand, and make sure that that brand is for that area, because that's why we have a beginner's, experience, and advanced. So your practitioner should be honest with you and tell you how much experience they have with that product, how many cases of vascular complication they had with that product, and the risk. So you are entitled to ask that. I normally, when I'm doing lips, I love brands like Keys or Revanese, because I know that I am in a dangerous area, and if something happened, I know it is very easy for the protocol to be applied and to have really great results to stop the ischemic injury. So I'm going to continue. I'm just showing